Hi everyone, we are excited to bring you the largest expert Q&A to date. See, we've got lots of screens for you today, so we're excited about that. This is our VTM team, that's what I've named them, from Texas Tech University Health Sciences Center School of Pharmacy. Welcome everyone, so glad to have you all here. This is Dr. McLaughlin, Dr. Bickel, and Dr. Knatzer. Thanks for being here, guys.
Thank you.
Thanks.
So we're going to talk about this exciting project that you guys have been working on. But before we do that, I kind of want to hear what your day jobs are at the School of Pharmacy. So Dr. Bickel, we'll start with you.
Okay, so I'm a professor in the Department of Pharmaceutical Sciences in the School of Pharmacy in Amarillo. And I'm Associate Dean of Sciences for the whole School of Pharmacy. And I've been here for about 20 years. My background is I'm an MD with a clinical pharmacology background, and I'm doing research usually in non-COVID times on the blood-brain barrier, drug delivery to the brain of macromolecules like protein drugs, antibodies, and so forth. Yeah, and that's about what my day job usually is. So I'm not a virologist by my training.
All right, Dr. McLaughlin, how about you?
Hi, Eric McLaughlin. I'm the professor and department chair for pharmacy practice, also here in Amarillo. I came in around the same time as Dr. Bickel, been here about 20 years now. So as a department chair, in charge of faculty on all of our 4 campuses that we've got. I do administration, obviously. I'm a clinical pharmacist, so I practice over with family medicine and team-based care. And I'm definitely not a virologist. My area is actually cardiovascular disease, primarily chronic cardiovascular diseases, particularly high blood pressure, high cholesterol, diabetes as well. I practice still with the family medicine clinic a couple half days a week, and still do some teaching and research in those areas. So this is a newer area for me, but I am maybe more versed in management and logistics, which is kind of my role here. So.
And clearly an avid outdoorsman as well. So we're glad to see you experiencing Paladuro Canyon today. All right, how about you, Dr. Knatzer?
My name is Michaela Knatzer. I am an assistant professor here. I've only been here for 7 years, so I'm kind of the baby of the group. My specialty is labs, sterile compounding, hospital pharmacy. So this kind of is in my area what we're doing. I normally do teach the labs, and I'm the director of the practice labs and simulation here in Amarillo.
This has been a really fascinating process to watch. You know, when we kind of started hearing more about COVID, there was a limited supply of tests, and that, you know, there are different components that make up those testing kits. So, you know, that we're calling them. One of those is VTM. And there was a shortage of that. And you guys sort of partnered with the School of Medicine to come up with a way to get VTM not only to here in Amarillo, but to elsewhere as well. Can you kind of talk about the inception of that project?
Yeah, I think this started when Eric texted me that he got a request by Todd Bell, who is a professor, associate professor in the School of Medicine and Pediatrics and involved with the public health department in Amarillo, asking about viral transport media, if there would be any in the school. That we could spare, basically. And so we were pretty sure that most likely there were none, because none of our colleagues is doing virology. So we asked around, and within a day we knew that there is none. And then that was, I looked back just now, this was on March 12th, so just around the time when all this campus closure and so forth was under discussion. And then for a few days, nothing happened. And then I started doing a little research, literature searching, and I found that it's not very difficult to make these vials. I was curious what's in there, because I'm not a virologist. What is a viral transport media? So looked it up, and it's basically just a buffer with some protein in there and antibiotics and antifungals that no bacteria or fungi can grow in there. So I found a recipe from the WHO that was published in 2006 after that SARS pandemic. And I asked Eric and Todd Bell if that would be something that would make sense to try and do. And then the answer was positive and to explore that. And so we started collecting information about all the materials we had on site. Like many of my colleagues and myself, we are doing a lot of cell culture work, so we have all these ingredients already there, and we made an inventory of that. And so I think on March 23rd, then we made our first batch with that WHO protocol and produced that at a site where Eric can talk more about that, because we wanted to do it in a fully professional way in a sterile environment. So I'll let Eric take over from there.
Yeah, and just to add a little bit there, we weren't sure. Since this is a little bit new for us, we wanted to make sure that we were doing it in absolutely the most sterile fashion possible. So my wife has a pharmacy, Medicus RX, and so she kindly agreed to, her and her partner, Brent Dance, allowed us to use that space, their clean room, and they have an isolator box as well. So it's very, very sterile. Allowed us to produce the first batch there. And then from there, once we did a little more research and made sure that the laminar flow hoods that are at the school met the minimum specifications that would allow us to make this stuff appropriately, we were able to kind of move operations over to the school. We've got a bit more room there. We've got more space. We can have 3 folks with sterile products expertise and training, be able to prepare the stuff at one time. And it allows us to a lot more space as well to prepare the labelings and the vials and all that. And, thus far, I think we've done close to, y'all correct me if I'm wrong, I think as of yesterday's batch, we would have around 11,000 plus another, maybe 4 that we're going to do today. So we're getting up around 15,000, I think, after the end of today. And they've gone all over West Texas, and obviously using a bunch in Amarillo for our drive-through. And that's obviously a number one high priority, to make sure our own community is covered. But there's folks in need elsewhere. We've sent VTM to Lubbock, La Mesa, Muleshoe, Littlefield, Hereford, Abilene, Dumas, kind of all over the place. And so, again, just trying to meet the need, since there is such a shortage right now. We thought we might be just doing this a month or maybe 6 weeks as a bridge to get us through until some more commercial VTM is available, but it's still awful hard to come by. So, we've been having to do this a little bit longer than I think we had initially intended, but as long as there's a need there, we're going to kind of continue to work to meet that need.
I think also, if y'all can explain the importance of VTM and why we need it. You take the swab and then you put it in the tube of VTM. Why is that so critical?
The virus, although it's very infectious, is pretty sensitive. So once you take the swab, it has to be transported typically to a lab where it's analyzed with PCR, with a molecular biology test. And during that time, it can degrade. So it is preserved in this viral transport medium, which is a buffer with some proteins, as I said, and antibiotic to prevent. Of course, it's not sterile. When you take a swab from your throat, there is a lot of bacteria in there. You don't want to overgrow these bacteria, and they would destroy the viral RNA. So that is basically a protection for transporting these viral samples to the diagnostic lab. And it can be when it's refrigerated, be stable for a day or so or more in that medium. That's the purpose of that.
So basically, it ensures that you're getting a correct test once
Yes, and you may have heard or seen in the last few days, there was a lot of discussion about false negative tests. With that, like that Abbott Rabbit test has a false negative rate of like 15%, which is pretty bad if you send out people who think they are negative and they aren't and spread the virus. So it's crucial that you come to as close as possible to 100% sensitivity with your diagnostic test, and therefore you need to first do the sampling in a correct way with these nasal swabs, and then protect the sample as good as possible until it's finally diagnosed.
So I think Dr. Knatzer, maybe you can speak to this. I think it's fascinating, first of all, that we have a medical institution in our community that is able to support communities like this in this way. You don't get that everywhere. I think it's nice to be able to have that here, but also it's a great learning tool for students as well, right? I mean, this is a once in a lifetime experience that they're finding ways to make an impact and make an impact quickly.
Yeah, I mean, it totally is. We're all learning, and we've learned things that, we never thought we had to do before. And it's so cool to be able to pass that on to the students. That way, if future something comes up again, there's something that they can say, oh, during school, this happened. And we were allowed to, see what was going on. We were allowed to compound and stuff like that. So I think it's a great learning experience. And people are stepping up in ways that are just so outside their realm of their normal job or behavior that it's been amazing.
And I would say that, how does it make you guys feel too, to be able to that's thousands and thousands of tests that you've helped to provide. That's amazing.
It's really nice. I mean, I grew up in the Panhandle, so I've lived in all the small towns here. So it feels nice to be able to give back to the community and do what we can and help keep people safe.
Well, I think it's so cool. So if people out there that are watching, I know I've even had requests from smaller communities. How can we get our hands on some of this VTM? What can we, are you sharing it? What's that process look like? Dr. McLaughlin, you want to talk us through that?
Sure. Right now, we've obviously mentioned earlier, kind of partnered with the School of Medicine for that. So we're sort of the producers, and we're letting them handle the logistics as far as requests that come in and where to ship out. Kind of depends on the supply we have, what we're allowed to make. We're not out to make a profit on this. We're basically covering our production costs is what we're doing. So, but if folks are interested or have a need for VTM in their community, they should really probably contact the School of Medicine. And specifically, I believe Holly Reinhardt is our staff member at the School of Medicine that's really helping to lead a lot of the logistics and shipping, as well as Dr. Spar and of course Dr. Todd Bell. I also would mention Paula Winkleback, who's been outstanding as another administrator at the School of Medicine that we work very closely with in this project.
I also would wonder how can you replicate this in communities all over, not just in Texas, but are there ways, if you found a sterile room, I don't know, I'm not using the right words, but a sterile facility, could you make your own VTM essentially? Is that something that could happen?
It's definitely a possibility. We kind of wrote up how we do ours, but there can be different ways to do it as long as you can get the ingredients and the people with the know-how. It's really not a hard process. Time consuming, yes, but not really difficult.
We've shared what we did. Michaela mentioned writing it up, and we did share that with a lab down in Lubbock. Dr. Bickle might talk a little bit more about that, and I think they are starting now to produce VTM, and I believe there's Uli, 4 or 5 other labs or places in the country, universities that are doing this?
That's correct. As of last week when I checked on just Googling, I found like 4 or 5, mostly in university settings like we are, who doing very similar things, started about the same time and providing for this local city and the surrounding areas. And we are now in parallel basically doing this with Dr. Harvinder Gill's lab on the main campus in Lubbock. He's usually, I think, doing research on nanoparticles or nanomedicines. So they have similar setups, I would assume, like laminar flow hoods and cell culture facilities. And that's the kind of setting that you need. You need a laminar flow hood, sterile hoods, and the ingredients, and of course, be capable of doing a sterile technique. I mean, that is essential. We have to test all these batches for sterility. That is our internal quality control that we are doing. But I am absolutely convinced that there could be hundreds or thousands of places around the country doing this. And if you imagine that right now they say if you want to loosen the social distancing restrictions significantly, you would have to do like 1 million or more tests per day in the country. And we have right now maybe had somewhere between 4 and 5 million tests been done in the entire 6 weeks or so that's going on. Then that just shows what the tremendous demand or need there is still to ramp up capacity. And I think in this situation where obviously the commercial suppliers cannot expand their capacity fast enough, academic labs and other similar settings could step in there and do that for their local areas like we do it here.
Well, it is certainly fascinating, and I've really enjoyed kind of going on this journey with you guys. Thank you for sharing your story, and thank you so much for all the work that you're doing. You are really, really making a difference. We appreciate your time today.
You're welcome. Thanks, Megan.